Hello, I'm Corey Backer, Director of Respiratory Care at Vibra Hospital of the Central Dakotas in Weaned, North Dakota. We specialize in a wide variety of respiratory care services, ranging from simple oxygen therapy to ventilator and trach weaning. Inevitably, one of the first questions we're asked by family members is, how long is my family member going to be on the ventilator, and what is the process for liberating from the ventilator? And today I have Erin. She's one of our respiratory therapists, and she's going to explain just that.
So first of all, when we get a new admission, we do their initial assessment. So they will be transferred here, we'll get them onto their previous ventilator settings, we'll assess when their trach was placed, what size of trach they have, and then we will formulate an individualized weaning plan with the pulmonologist or the pulmonology nurse practitioner that we have working here. So we do our initial assessment and kind of educate the patient and the family members about the process, the weaning process, and how we're going to go about this with them. We serve as their advocate because the patients, they can't talk or breathe on their own, so we need to be reassuring them that we're closely monitoring them and are an active part of their care plan as well. So our initial ventilator weaning trial starts with what's called CPAP mode. So the patient is spontaneously breathing on the ventilator with pressure support. This helps determine what their respiratory muscle strength is, kind of gauging where they are in that sense. And once they're tolerating that for a period of time, then we move to what's called the trach collar trial. It's heated and humidified air that we can add supplemental oxygen into. It sits right around the trach here, and then there's no ventilator support with that, so they're just breathing on their own. Once they're tolerating that for a period of time, then we continue on. We bring out what's called the passing mirror valve, and that serves as a speaking valve, so we hook that onto the trach, and then the patient is able to verbally communicate with us. This helps retrain their upper airway. They're able to manage their secretions a little bit better, reduce the risk of aspiration with that. And after they tolerate the PMV for a certain amount of time, then we move to what's called capping trials. So this is basically a plug that sits on the end of the trach, completely blocks air movement in and out of the trach, so the patient has to breathe through their nose and mouth. And this is basically the final step before we would decannulate the patient. So if the patient is managing their secretions, talking, tolerating the capping trials for about 24 to 48 hours, then we consider decannulating the patient, which would be taking the trach out.
All right, thanks for watching. I hope you learned something about respiratory care and the process of liberating from the ventilator.